Hello everyone. Welcome back to my channel, your go-to place for a smart, simplified, and exam-focused platform. In today's video, we will go into a detailed breakdown of elastomeric impression material, covering the properties, composition, setting reaction, pros and cons, and clinical applications of each type. Before starting with each type, let's first understand what elastomeric materials are. These are non-aqueous, flexible, rubber-based materials used for making highly accurate dental impressions. These record fine surface details, having excellent elastic recovery. These are ideal for indirect restorations, such as crowns, bridges, inlays, onlays, veneers, and implants. Elastomeric impression materials are classified into four types: polysulfides, polyether, condensation silicones, and addition silicones. Let's start with polysulfides. Polysulfides are composed of two pastes, base paste and catalyst paste. The base paste consists of a polysulfide polymer with mercaptan groups, filler particles like titanium dioxide, zinc sulfate, and silica, to provide the required strength, and a plasticizer such as dibutyl phthalate, to confer the appropriate viscosity to the paste, and lastly, some sulfur compounds acting as an accelerator. The catalyst paste, which contains lead dioxide as an oxidizing agent, plasticizer as dibutyl phthalate, and oleic or stearic acid as a retarder to control the rate of the setting reaction. Lead dioxide is the component that gives polysulfide impression material its characteristic brown color. The setting reaction of polysulfides occurs as a condensation polymerization of mercaptan groups with oxygen groups, activated by an oxidizing agent, lead dioxide. The reaction begins at the start of mixing and reaches its maximum rate shortly after spatulation is complete. At this stage, a resilient network has started to form. During the final set, a material of adequate elasticity and strength is formed that can be easily removed past undercuts, yielding water as a byproduct. Moisture and temperature have a significant effect on the course of the reaction. In particular, hot and humid conditions will accelerate the setting of the polysulfide impression material. This material has the highest working time, 5 to 8 minutes, with a setting time of 8 to 14 minutes. It is a hydrophobic material, showing properties of high tear strength and flexibility, good elastic recovery, and longer setting time. The following are the advantages and disadvantages of polysulfides. It exhibits a good reproduction of detail, with excellent tear strength. It has a high flow, making it ideal for full arch impressions. The longer working time allows for more precise placement. But it has more disadvantages. It is messy to handle, with a strong, unpleasant odor and taste. It stains the clothes due to lead oxide. It requires immediate pouring in custom trays to reduce distortion. It has a toxicity concern due to lead dioxide. Before taking an impression, a tray adhesive is applied at least 5 minutes before loading the material. It is used in full arch impressions, complete and partial dentures, and in cases where tear strength is critical. It should be stored in cool and dry conditions. Contamination of both pastes should be avoided. Instruments must be cleaned immediately after use. For disinfection, iodophores or glutaraldehyde can be used, with disinfection time must be less than 10 minutes. Besides all of this, there is a clinical decline in its usage, being replaced by addition silicones. Moving next to the condensation silicones. It is supplied as a base paste and a low-viscosity liquid catalyst, or paste catalyst, a two-paste system, or a two-putty system. The putty can be used as the tray material in conjunction with a low-viscosity silicone, which is referred to as the putty wash technique. The base paste consists of hydroxyl-terminated polydimethylsiloxane, along with some inert fillers, pigments, colorants, and plasticizers. The curing of this material involves a reaction of tri- and tetrafunctional alkyl silicates in the presence of stannous octoate as a catalyst, present in a catalyst paste. It also contains some filler particles and aromatic oils as modifiers. The mixing ratio is 10:1, 10 parts base and 1 part catalyst. It is set by cross-linking between terminal groups of the silicone polymers and the alkyl silicate in the presence of tin octoate, to form a three-dimensional network. It yields a byproduct, ethanol, which evaporates over time, resulting in dimensional shrinkage. This material has a working time of 2 to 4 minutes, with a setting time of 5 to 8 minutes that varies with temperature. Moving forward to its properties, it is hydrophobic in nature, which limits its use to dry fields. It has poor dimensional stability, moderate tear strength, but has improved elasticity over polysulfides. Condensation silicone has the following advantages. It has a pleasant odor and taste, and is comfortable for patients. It is economical and is available in different viscosities. With a good elastic recovery, it has improved aesthetics. However, as it yields alcohol as a byproduct, upon evaporation, it results in shrinkage, therefore, it requires immediate pouring. It also has poor dimensional stability. It cannot be repoured and is not suitable for recording the subgingival margins. For that, the putty wash technique is preferred. A tray adhesive is applied 5 to 10 minutes before loading. It is widely used in fixed prosthodontics, study models, and preliminary impressions. It is not ideal for long-span bridges, due to dimensional changes. It should be handled with sulfate-free gloves. Avoid storing it in warm and humid environments. For disinfection, iodophores and short-time glutaraldehyde are used. Sprays are preferable over immersions. These are some clinical tips that you can use in your daily practical life. Moving towards the gold standard, addition silicones, also known as polyvinyl siloxane. It is also composed of base and catalyst pastes. The base paste consists of polymethyl hydrosiloxane, as well as divinyl polysiloxane, and some inert fillers. The catalyst paste also contains divinyl polysiloxane, platinum salt as a catalyst, and some filler particles. The mixing ratio of base and catalyst paste is 1:1 by volume. It is set by an addition reaction between vinyl groups and CH bonds, catalyzed by platinum, forming a cross-linked rubber, without any byproducts. No reaction byproducts are formed as long as the correct proportions of divinyl polysiloxane and polymethyl hydrosiloxane are used and there are no impurities. However, the residual polymethyl hydrosiloxane in the material can lead to a secondary reaction with each other or with moisture, to produce hydrogen gas. This hydrogen gas is a byproduct that does not affect the dimensional stability of the impression. Nonetheless, the hydrogen gas evolved can result in pinpoint voids in the gypsum casts poured soon after removal of the impression from the mouth. Therefore, a noble metal such as palladium is added by manufacturers, which acts as a scavenger for the released hydrogen gas. The working time of a regular set is approximately 2 to 3 minutes, and for a fast set is almost 1.5 to 2 minutes. The setting time of a regular set is 6 to 7 minutes. And that of a fast set is 3 to 5 minutes. It is hydrophobic in nature, but new formulations are hydrophilic modified. It has multiple viscosities, from putty to light body. It shows excellent dimensional stability and elastic recovery. It has moderate tear strength and gives very high reproductive detail. The following are the advantages of addition silicone. It is the most accurate and dimensionally stable material, and can be poured multiple times. It is odorless and has a pleasant taste, and is compatible with automatic mixing devices. It shows minimal shrinkage and has excellent elastic recovery. But it has the following disadvantages. It is expensive. Its setting reaction can be inhibited by latex gloves. Sulfur in latex gloves interacts with the platinum catalyst, inhibiting polymerization. The older versions are hydrophobic and can cause voids in a moist environment. It is a technique-sensitive material. These are impression techniques using the addition silicone. First, putty wash 2-step technique, in which putty is used first, followed by light body. There is a risk of distortion in this technique if putty is compressed during reseating. Second is putty wash single-step technique, in which putty and light body are placed simultaneously. It results in good details with uniform pressure. The third technique is monophase, in which medium body and heavy body are used. An incorrect ratio of both base and catalyst paste can lead to an incomplete set of material, inhibition, reduction in tear strength, and poor dimensional accuracy. It is ideal for fixed prosthodontics, implant impressions, and CAD/CAM scanning. These are some clinical tips for handling. A compatible tray adhesive must be used for at least 10 minutes before loading. For disinfection, glutaraldehyde and iodophores are used, but avoid long immersion. These are some common errors, their causes, and solutions. Last but not least are polyether rubbers, which are also composed of a two-paste system, base paste and catalyst paste. The base paste consists of a polyether polymer with reactive terminal groups and filler particles like silica. The catalyst paste consists of aromatic sulfonic ester, acting as an initiator, some filler particles and accelerators. It undergoes the cationic ring opening polymerization, with no byproducts, resulting in a cross-linked elastomer. The working time varies. The working time of the regular set is 2.5 minutes, and that of the fast set is 1.5 minutes. The setting of the regular set is 6 minutes, and that of the fast set is 4 to 5 minutes. Polyether is a naturally hydrophilic material, making it ideal for moist conditions. It is a stiff material, making it harder to remove from undercuts. It has excellent dimensional stability, good elastic recovery, excellent detail reproduction, and high tear strength. It exhibits low shrinkage. It has the following advantages: it is hydrophilic, has excellent flow, and yields no byproducts. But it is rigid after setting, so difficult to remove from undercuts. It is expensive and has a short working time. It is used in fixed prosthodontics and implant impressions. It is ideal for a moist environment such as the gingival sulcus. A tray adhesive must be used before loading. Avoid soaking in water. Avoid using in high undercut areas. For disinfection, iodophores and glutaraldehyde are used, for a short time only. These are the most asked questions in exams and clinical viva. If you want answers to these questions, comment below. That's the wrap-up for elastomeric materials. Thanks for watching. I hope this video is useful for your knowledge. Like it and share it with your friends. And don't forget to subscribe for more dental lectures. See you in the next video.